This is directed to you, small or medium-sized business owner. Here's an important message about protecting your most precious asset. Let's first find out what it is we're talking about. Meet Hank. Hank is a neighborhood merchant. Hank, what is your most precious asset? Well, it's not my store fixtures and it's not my equipment. Well, what is your most precious asset? It's not my inventory. It's not even my expertise and my friendly personality. So what is it then? Simple. It's my people. Here's Hank's people. He's talking about his staff, his employees, my outstanding team who have the most to do with the success of my business. Hank is really a great boss because he understands the importance of employee satisfaction. Here's a little quiz. Which benefits are most important to small and medium business employees? Is it a retirement plan, 401ks, for example? Is it the employee discount that he grants them? Is it health benefits? Is it maternity or paternity leave? Is it vacation or other paid time off? Which one ranks number one? Well, if you said health benefits, you're correct. In fact, health benefits rank in importance in small and medium business employees more than all the other factors combined put together, according to Glassdoor, which says they have a 95% accuracy level. And this information was obtained through looking at over 190,000 different postings at the Glassdoor website. So they know what they're talking about. So why is this important? Well, according to numerous studies, including a recent one in the International Journal of Learning and Development, low job satisfaction causes low morale, lower loyalty to the company, lower productivity, higher stress. The bottom line is this: all other factors being equal, companies that report lower levels of job satisfaction consistently report lower profits. In other words, it's just good business. Healthcare, though? Isn't that a pretty expensive benefit for a small business to offer to its employees? Well, the answer to that question, let's ask Hank. He says yes, it used to be. If you were talking about a standard group health insurance plan, I could never afford one of those. Fortunately, there is something new and better available. It's a group primary care plan being offered by Weisz Concierge Medical exclusively to Palm Beach Gardens small business owners. It costs much less, and it delivers personalized medical care, and it makes me a hero in the eyes of my people. I'd like to introduce you to someone, the doctor, Dr. Alla Weisz, to let her tell you how it works. Hi, I'm Dr. Alla Weisz, and I'm proud to introduce you to a unique and affordable healthcare program for your employees. It's not really a new way of doing things at all. It's actually the way that medicine used to be practiced before the government and the insurance companies got involved. It's called direct primary care, and it's based on building a caring relationship between the patient and the doctor without all the hassle and all the headache of dealing with Medicare and with insurance companies and the like. This cartoon kind of sums it up. The doctor is trying to look into the patient's ear, and the patient says, "Doc, can you see the problem?" And he says, "Yes, I'm afraid so. There's a barrier there." Direct primary care gets rid of that barrier. That's basically it in a nutshell. Dr. Weisz says, because I keep my patient count low, I am able to practice medicine the way it should be practiced. I'm always accessible by phone, by text, email, video chat. I can see patients the next day and often on the same day that they make the appointment. There are no long waiting room waits. House calls are available if medically necessary. I see patients as often as necessary for the same monthly price. I take all the time I need with each patient. There's no rushing from one patient to the other. I get to know each patient. I get to know their families. I get to know them as people, not as medical statistics. I can prescribe medications, perform procedures, and refer patients to a specialist or to a hospital if necessary. There's no copay, there's no deductible to fulfill, there are no insurance hassles. It's basically like having a doctor in the family. Before going to Dr. Weisz, this is what my doctor looked like. This is what one of Hank's employees had to say. She says, "Now I feel like I have my own private physician. It is one of the best parts of working at Hank's. I'm so grateful to Hank for introducing us to Dr. Weisz. It's like having a doctor in the family." Well, Hank says, I had questions, so do you. Here are answers to some of the more common questions that are probably on your mind at this point. What if my employee is already covered by health insurance through a spouse or through Medicare? Well, the eligibility for your group is entirely up to you, the employer. If you wish to offer the benefit to covered employees, you may do so, or you may withhold it. There's nothing governing this except your own judgment. Is this plan a substitute for health insurance? Well, not entirely. An employee who participates in this plan should also carry major medical insurance in case of serious illness or accident. You may opt to offer your employees a major medical plan that will cost a fraction of what a fully comprehensive plan would cost. Upon enrollment, your employees will be encouraged to seek major medical coverage if they don't already have it. How is DPC medicine different from traditional healthcare? DPC, or direct primary care, meets your employees' routine, everyday medical needs, such as annual and school physicals, referral to a specialist, minor injuries and ailments, overall wellness, etc. Here, I'll give you an analogy. Think about your car. Okay, now, do you carry insurance to pay for predictable everyday routine costs like an oil change, a wheel alignment, minor dents and scrapes, brake replacement, battery replacement? The answer is no. Nobody carries insurance for that. Those are routine automotive needs. Well, the same is true for medical needs. But you do carry insurance in case of an accident or an unpredictable event or something of that nature. That's why you need insurance. But it's the same analogy here with medical care. Another question, do I pay for it all or do I split the cost with participating employees? Once again, it's entirely up to you. Some employers offer it as a vested free benefits after a specified waiting period. Others offer a split dollar plan based on the number of participating people in the employee's family. Again, it's up to you to structure it, and we'll help you. Weisz Concierge Medicine will be happy to work with you to design the perfect plan for your group, and that will make you into the healthcare hero. And now for the big question. How much will it cost? Well, quick answer, much less than you'd expect for this level of concierge service, much less than a traditional insurance-based health benefit plan. Let's take a look. Costs are based upon two factors. A, the number of employees and spouses in the group. A group may consist of a single employee up to a maximum of 50 employees and spouses. And B, the average age of employees and spouses in the group. There are no long-term contracts. You will be invoiced monthly based upon a monthly participation survey update. Every month someone will call you and ask if any changes since last month, anybody left the group, anybody be added to the group, and your monthly invoice and your coverage will be based upon that information. Dependents are defined as children of a participating employee under the age of 27 living with the participating employee. So if the employee has a child living with them at home up to age 26, they are covered, and they're covered at a reduced rate, as you will see. So we have the number of employees and spouses in the group. Then we have three categories of ages: 21 to 35, 36 to 55, and 56 and higher. And again, these are not individualized ages. This is the average. You add up all the participating employees, and you divide by that number. You add up their ages, and then you divide by the number of employees. That gives you the average age for the group. And here are the monthly costs. If there are 1 to 5 people in the group, it's $100 a month per employee, $75 for dependents. Higher age, next higher age, 120 and 90. Next higher age, 140 and 105 for dependents. That's the highest monthly rate category, 140 per month. That would be if you have a very small group and if you have an older average age demographic. Next are 6 to 10 employees and spouses. Again, that goes down, and then it goes up by the age. So the larger the group, the lower the cost. The older the group, the higher the cost. Okay, and you can see those numbers there. Up to a maximum of 50 in the group. After that, you're not really a small employer. So here's an example. Let's take a look at Hank's business. He covers 5 employees plus himself, so that's 6. The average age of the participating members is 29. 3 of the employees have a total of 5 children covered by the plan. So you've got 6 adults and 5 children in the plan. There are no spouses in this particular group. All the spouses are covered elsewhere. The cost is $475 a month for the adults, plus $350 for the kids, for a total of $825 per month, or $9,900 per year. Major medical coverage for this group could be attained, there's a wide range, but an average of around $4,400 per year. So you add those two together, the DPC plan plus the major medical. Hank covers all of his employees' medical needs, both the everyday routine and the major medical, unpredictable, for a total of $14,300 per year. A conventional, comprehensive insurance plan that would have for the same coverage for the same size group would come to about $25,000 a year. Essentially, we are talking about better care for less cost. So let's sum it up. Why DPC? Well, the main reason is better care for your most important asset, your people, your staff. Now, what does that mean? It means better health outcomes. Patients achieve superior health outcomes. That can be demonstrated easily. Lower costs, as we've shown. And an enhanced patient experience. And that's the most important thing for you as an employer. That enhanced patient experience is what will build loyalty and top performance from your team. So we urge you to visit the website to learn how you can become a healthcare hero like Hank. Here's the address. It's WeiszConciergeMedical.com. We urge you to get to know Dr. Weisz. You'll find her to be a knowledgeable and professional and highly accessible individual. Your employees deserve quality, personalized concierge healthcare, and they will repay your investment with loyalty, with dedication, and with outstanding job performance. Let's say goodbye to Hank. Thank you, Dr. Weisz. He says, my people could not be any happier with the quality of health care they are receiving. Thank you, Hank. For more information, there's the website. You can call or text Dr. Weisz directly at this phone number or email her at this address. Thank you. Thank you for your attention and for your interest.